Hi, everybody. How are you guys doing today? This is Jim from the Pain PT. Good to see everybody here. I have another success story. I love bringing success stories to you guys, show you the value of this work. I have Petra here and her husband on the line. I'm really happy to have them both here because you're going to get a unique perspective of two sides of the story. And I'm really happy to have both here today.
Thank you,
Perfect.
Jim.
Thank you, Jim.
Yeah,
Thank you for
yeah,
coming up.
yeah, great. I'm going to turn over to you and Petra, maybe just you could share your story and I'll just jump in with some questions along the way. And
Yeah, perfect. Yeah, my story is a story of 3 decades of chronic pain. I was really at some point at rock bottom, and now I'm doing the things that I had only dreamed of for so long. I'm actually doing things that I never thought would be possible now for me.
Yeah, from rock bottom to top of the mountain.
That's true, yes.
yeah, yeah. Well, let's it's really amazing. Well, I want to hear about it. So let's
And
start from the beginning and share that.
quite literally top of the mountain
Yeah,
with hiking and mountain biking that we're doing now, which were absolutely unthinkable
Yeah,
on
yeah,
at rock bottom.
yeah,
yes.
that's amazing. That's amazing. Well, maybe take us back to the beginning, to the bottom and what
Yes,
happened.
yes. So it all began about 32 years ago. It was that after hikes or skiing or biking, I started to experiencing knee pain. And then what you do is you go to the orthopedist, and the first orthopedist told me, well, there's really nothing I could do, but prescribed me some physical therapy. I was doing the physical therapy and really, did exactly what they told me, and but nothing changed. It didn't get better. So then the second orthopedist that I went to for another opinion told me, well, by the time you're 50, you most likely will need a knee replacement. And that totally scared me.
Mm.
And I did not want to get a knee replacement at age 50.
What do they
And
find on your reports? Do they find things on your scans, your MRIs, X-rays?
yes, they contour Malaysia, and they told me that the patella is too small. There was other things, but I forgot the total details. But these were the major things. Do you remember more?
Yeah, there was, I think, also some speculation, not really hard diagnosis in that sense, but they said the patella may be a bit too small and may not glide in the exact position where it's supposed to be, which then led to the first set of surgeries that you had.
Yeah, yeah. Then she
This
told
was
me
on one knee or both knees that you had this?
both knees. It was done
Both.
bilaterally, and then the lateral release, it's called, was done, and also some meniscus repairs. And then once,
If I may add to that, the meniscus repairs was just regular, what is called shaving. So everybody in his menisci have some rough areas, which is normal wear and tear, and they just shaved that. It sounded at the time much more dramatic than we now know what it really was, right? I mean, it was, and nowadays most in arthroscopic interventions don't even do that anymore because it's normal, right? It's that's what people have.
That's
And
right.
even at that age, we were 21 when that was done, or 22, 22.
22, I think.
Yeah, not that it matters too
Yeah,
much now
somewhere
after that
around.
amount of time. But again, it's still even then that was quite normal. And
Yeah, and for the audience listening, Juergen, you're a physician, right? So just so people know, your background as a doctor trained,
yes,
right?
that might help, maybe helpful to understand why I'm using all these technical terms.
Yeah, I
So,
know, because some people think, wow, he knows what he's talking about. He actually does. He's a doctor.
and if I use too many of them, please hold me honest there so that
Yeah,
I'm not.
we'll bring it down so the audience understands. But that's great. So that was a young age. You were young, right? 21, 22.
Yes, yes, yes. And then from the surgery, I never recovered. And on the contrary, things got much, much worse after the surgery. I went through physical therapy, and but in my left knee, I still had a constant light swelling, and I had some blockage that just didn't resolve. And I developed chronic pain. after the surgery. So then I didn't just have pain when I was active, I had pain constantly. And I needed also my knee braces really basically constantly. I mean, sometimes I could leave them off, and and sometimes it was also varying. Some years were better than others. So, but I had terrible pain, whether standing, walking, or sitting. I only had some relief lying really down straight in my bed.
Wow.
And I couldn't run anymore. It was just out of the question. I could do some walking. We definitely could still do walks, but I needed the knee braces. And what I, in addition, developed was allodynia. And that's a disease where even the lightest touch causes pain.
Yeah,
Or
like a sensitivity.
yeah, sensitivity, exactly. Or pants, wearing pants would, just hurt. And
It was to the point that when I would touch her just like that, she would cry out in pain.
Was it just on your knee or legs, or did it spread to other areas too?
at that time, it was just on around my knees.
Okay.
And lots of physical therapy, enormous amounts of physical therapy, but it did not make the pain go away.
Yeah. Okay. So
And
at that point you were how old were you then? That was like how many years after the surgeries, or how long did that?
I mean, right after the surgery, I never really got.
Never had any, yeah,
I
relief.
never,
Okay.
yeah, I never had any relief. It just, yeah. And then we saw countless orthopedists, specialists, and what you do when you get desperate and want things so badly to the pain to go away and to be active, from acupuncturists, chiropractors, pain specialists, neurologists, and all of them were really well-meaning, but nothing helped. It was very, very frustrating experience.
Oh, yeah, that was
Because
certainly true.
they gave me pills, they gave me creams, cortisone shots, more physical therapy. And then Juergen said, I think there is something neurological going on. And he said, go to a neurologist too. Or you said, maybe you can explain that better.
Yeah, I mean, I saw the MRI images, I saw the X-ray images that were done. There was never anything on it. I mean, there was on it what should be on it, right? But nothing else. There was no chondromalacia on it. Sometimes they were trying to speculate, oh, there's a little dark spot over there, that might be it. And what was very understandable from Petra's perspective, that she hang on to that, right? So there's something bad in my knees,
Oh, yeah.
even though there really wasn't, right? And then I always say, you don't really, your knees are fine. I don't know where you get the idea from that you might be needing a knee replacement. Your knees are youthful, right? I mean, even
Yeah, but that messaging from the physicians, and they're just looking for something to put the pin it on, something structural, right? And that obviously scares people.
Yes.
like-
I wanted an explanation. It was like, I'm not crazy. I'm having pain, But they're all saying me I shouldn't have pain.
Yeah, I was the only
it
one
shouldn't
saying
be
you
as
were
bad.
crazy, right? No,
You're probably the only one who's saying you weren't crazy, and all the other doctors saying you were.
no, I never said that, but I did say
course.
that there's something else. You don't have structural issues. There is something that is triggered in your nervous system that gives you that impression. We had no idea about mind-body syndrome at that point.
Yeah, at
right?
this point, it was not even on the radar, right?
No, at that time.
Having some medical background as I do, and having seen this and having seen just the evidence there, maybe, well, I wouldn't say objectively, but from a different perspective, it just gave us the impression there's something else. This just can't be it, that there is a structural orthopedic related issue here.
Yeah.
And I remember also you said there can be memory of pain, and you said, I think there's somehow a memory that is lodged in your nervous system, something
Just
like that.
so happens that I actually had some background in research background in this, in pain. And then I knew that that was relatively recent, that, again, this is 25 years ago, right? Relatively recent, that the phenomenon of pain memory, so that the body remembers what pain is now the foundation of mind-body work, right? But that the body remembers that and can recall that. That was the early stages then. And I was familiar with that. I read the research at the time. I was to some degree involved in that, not a large degree, but yeah, that's what I said at the time.
Yeah,
right?
yeah. So we said to a neurologist, and the neurologist prescribed me gabapentin, which didn't help, but also, couldn't help me. And then at some point, I made an appointment with a physician. He's called Dr. Schwartzman, and he is a chronic regional pain syndrome specialist and very well known. I think he retired by now, but it took a year to get even into his practice. And so he then said, it's not chronic regional pain syndrome, but it is a neuropathic sensitization.
Yeah.
And then he recommended ketamine infusions and ketamine coma. And he since wanted that I have these infusions 10 days as an outpatient. I looked it up before for the meeting. And then also 5 days with coma as an inpatient. And then traveling to Mexico, because this is not allowed in the US, and having their coma with high doses of ketamine, followed by booster treatments of ketamine.
Sounds great. Sign me up. Sounds terrible, right?
Yes, and then we discussed it, and we didn't feel comfortable. There's so many side effects and complications, and being in a coma with high doses, what's not allowed in the US, in Mexico, somewhere, it just didn't feel right.
Indeed, yeah. I mean, again, that was also made quite a number of years ago. In the meantime, I think there is some research that these type of treatments, they're dramatic, but apparently do facilitate sort of memory loss.
Mm-hmm.
So it's not entirely off the rails, right? But it was fairly speculative treatment at the time, that's for sure. That's why we said that seems a bit quite risky for the vague promise of improvement.
Yeah. Yeah. So you guys, okay, so you decided not to do that. And then what happened after that?
Yes. And then we, in between, sometimes the knees really got much worse, especially my left one. So I had to go back to orthopedic surgeons. And then they said, well, there's a possibility to do a knee surgery again to check it out. But they said, basically, it could be a slippery slope. It could just make things worse. And you were also saying, well, the knees really, the pictures don't look bad.
What are you going to do with your knees?
Yeah. And so we didn't do that. And I was told your pain is much worse than it should be. So we physicians don't understand pain. So one physician.
The point is there shouldn't be any pain. Because the knees looked fine.
Mm-hmm. Yeah. And I remember one orthopedist said to me, well, we physicians, we really don't understand pain very well. I have some people coming in who have terrible knees, bone on bone, and they have very little pain. And I'm like, how did you even get in here? I mean, your knees look horrible. And then I have people who have really good knees, and they have really terrible pain. And so he then said, you know what? You have to live with this just the best as you can, because they
didn't have an answer at that time, right? They didn't have an answer.
Yes. At that time, there were no answers, and that's really what I did then. Then at that point, you coached me a lot through that, and
I didn't lose hope, right?
In
contrast to you at the time.
Yes, yeah.
So this was like, where was this in the journey then? How many years into it was this now that you were just kind of trying to live with it for how long?
That was before I became pregnant, so that was maybe 25, 26 years old. But the Schwartzman, I'm not really chronological right now. The Schwartzman thing actually was much later when we already had children. So, but what the physician said to me was more when I was 25 years old.
Okay. Okay. So you went, so did you go for a number of years just living with it basically and not doing
Yes.
much or?
Yes, yes. And then I even was wondering, should I even become pregnant? What will the extra weight do to my pain? And, I was concerned about that. And then I can't run. Little kids, you need to run after them. And when there's traffic, you need to make sure. So, but we decided to have children.
But see, yeah, but go to that experience of pregnancy. I think that's also
That
indicative.
was so then I was pregnant, and during those pregnancy years, both we have two children, two pregnancies, my pain was so much better. That was crazy.
Basically gone.
Yeah, I said I should just be pregnant my whole life.
You gotta have a family of 12. Yeah.
My pain was so much better during the pregnancy, both of them.
Yeah.
We were like, how can that happen,
I've heard that before too. I had a woman who said she had, I think, 5 years of ongoing back pain. Nothing helped her. She got pregnant. The pain went away, and for her, it stayed away. It never came back after the pregnancy.
Hmm.
Yeah.
Good. And
Maybe
then,
we should have tried more often.
yeah,
Yeah. When you think about that in terms of this, the brain, right? Your attention swept away. The brain has a bigger focus point now. It has something bigger to focus on. And then the pain just it can turn off because that's it. It's not the priority anymore for the brain. So it just
yeah,
shifts into something better or different. And it's just like when you
yeah,
get a cold or you get a virus or you get a COVID or something. I hear all the time, oh, the symptoms are gone. And then a lot of times they come back, right? Once it passes. So the symptoms came back then after, or
yes, yeah, yeah. And then a couple of years later, again, I had two times where on my left knee, I basically lost a lot of muscles, so bad that I could only walk with crutches. And then I got cortisone shot and intense physical therapy. I always continued with my regular physical therapy, although the physical therapy really hurt. After and during, I was in a lot of pain, but I still felt I need to do that. That's what I'm being told. And then that was really hard. I slowly built the muscles back, but still the left knee was always then even worse than it had before. So
It would be fair to say that every episode of intense physical therapy led to a worsening of the pain experience. And I think that's important for anyone listening to understand that the traditional physical therapist does not understand this chronic pain pattern and what excessive training can do to that. It can have the opposite effect of what you actually want to achieve.
yeah, especially when
That
you don't understand the nature of what this is. Right? You're
exactly.
working off a physical premise. Yeah.
Yeah, and if you just do what you've learned in school for physical therapy, strengthen muscles no matter what, you have to work through the pain. If you have a chronic pain pattern with a mind-body syndrome basis on this one, it is likely to make it worse, to reinforce those learned pain patterns. And
Yeah.
that's exactly what happened to you.
that's what happened to me. Yeah, yeah.
Yeah. So things were getting worse, not better.
Yes, exactly, exactly. And my mental approach then was really, I just didn't want to talk about the pain to other people. I kept quiet about it. I didn't want to talk about my limitations. I pretended that it didn't exist and that I'm functioning kind of normal. So I didn't, when we met people, I just didn't, friends, I didn't talk about it. They mostly didn't really know about it.
Hmm.
At least friends that we new friends that we made that we didn't have from way back when everything started. So I really pushed down the pain and just tried to function as best as I could. And if somebody would ask me and said, "Oh, do you ski?" I might say, "No, not anymore. I have bad knees," but that was it. And but then social events were usually especially hard because I kind of pretended to be normal. And but standing really, really hurt. And usually you're standing a lot. And so I wore long dresses or skirts or pants that didn't show my knee braces.
And we planned ahead of the party for any way to find a way for her to sit, right? Any excuse, whatever we could do.
Yeah. I was usually the first one to sit, and Juergen made sure to, be with me, and maybe we'll ask. So we kind of, I'm laughing now. It was terrible. It was really, it was so hard. It was really hard. And the one upside that I could find about this were actually amusement parks that we went with our children, like Disney World, because I got a letter from the orthopedist explaining that I couldn't stand for long. So they basically always got us fast passes for the whole family and put us in right. So the kids loved that.
That's one of the perks, one of the positives. Yeah.
That was the one perk, yes.
But for anyone who's listening, this is not worth it.
No,
not worth it. I was going to say, not worth it.
Oh my gosh, no.
It really is not worth it.
No, it was terrible. Yeah, even that, I did not feel good. I mean, that was a little perk, but it's still just going to these events, just going in an amusement park, the anxiety that you have of, will I make it through the day? How will the day look like? How much pain will I have? How will I survive the day? Because you don't want to spoil it for your kids. You want them to have as much fun as possible. So the mental baggage that comes with this, the mental exhaustion, the mental fear is really actually tremendous.
Yeah. And it sounds like, even at that time, you weren't doing this work yet. You were in some ways still trying to function, right? You weren't talking about it. You were trying to keep going, right? You went anyway. So at least you didn't go so far, right? And maybe it gets worse. I don't know. You didn't go so far down to doing absolutely nothing. Right? You still were trying to function, but like you said, the fear, the anxiety, it starts amping up, doesn't it?
Yes. So everything, or every party that you go to, every event, you're just, hoping that you will be then somewhat okay.
Yeah.
And it's every time you're thinking about that.
Yeah, and we always had our excuse prepared in case you couldn't stand in the party to leave early.
Or
yes, it's always on your mind. It was like the first thing that was, even though you didn't speak it, in your mind, in your head, it was something you were always focused on.
Yes.
Speaking about perks, that's one of the perks of having kids. You always have an excuse.
Yeah, that's right. Yeah. So, okay. So you went again, how many years was this that you were just sort of doing your physical therapy, doing, traditional work, before you found Mind Body? So when did you find the Mind Body then? How far along this journey?
Oh, it first got worse, actually.
Okay.
We're not at rock
bottom.
We're not the bottom yet. Okay. Well, let's take us to that point. Yeah.
Then in my 40s, more than 2 decades after my first surgery, things with my left knee became really, really bad. Walking for more than a minute was excruciating. The knee was swelling more, and the pain, it was just spiraling. So at some point I just couldn't walk anymore, and I became dependent on a wheelchair. I could walk in the house maybe 1 or 2 minutes, but
maybe it's worthwhile mentioning that you did have a physical blockage in that knee. Mm-hmm. So there was really something in that knee at that time. And should I just explain that part?
Yeah, absolutely.
And so we went to a knee specialist in Hartford, Connecticut, traveled across the country to do that. And he basically said, well, you most likely have what is called a plica, which is a scar tissue formation within the knee as a consequence of the first surgery that she had, the original knee surgery. And that was confirmed via MRI as well. So that caused the actual blockage. So there was really a structural issue at the knee at the time. And yeah, we scheduled the surgery and went there, and he removed the plica. And what he did as well is reverse that lateral release, the original operation, which the lateral release meaning there was a ligament was cut so that the patella supposedly moves further into the direction where the orthopedist at the time felt it should float within the joint area. That made it originally significantly worse. So he reversed that basically, and then he could, with more recent methods, determine exactly how far that needs to be done so that the patella is really optimally positioned. That's basically what happened at the time. So that.
Yes, but even before, I was at the local orthopedist, and he told me, you shouldn't have this pain. Your knee is actually okay. And the physical therapy and more physical therapy, and I got more anxious and more anxious because I needed to be in the wheelchair for everything that was longer than 2 minutes, and so my anxiety really spiraled because I thought, how is this gonna end? They're telling me that I should be fine, and now I'm dependent on a wheelchair.
I'm danger of bashing my own profession here, but that particular orthopedist did not have the inclination that it might be plica that had fallen. Just didn't get that part, and we diagnosed. I diagnosed it, I guess, at the time, did some research on what could it possibly be and what would it look like, what kind of blockage, and that's what we then went to Connecticut for that.
Yeah,
and that really was.
So you had that removed, and after that, did that help you? Were you better after that, or?
The blockage was gone, but the problem was the surgery itself. When I do physical therapy, but my physical therapist, when I came in the first time, he said to me, "Oh, you're having one of the 5 orthopedic surgery that I do not want to have, and for stretching that ligament out and all, I'll give you a towel to bite on, and this is painful and this is quite a long recovery."
So that's not reassuring you to feel better.
No. And so,
and again, this particular physical therapist did exactly what should not be done, and I'm pretty sure you will never do in your practice, right? He did exactly the opposite of that.
Yeah,
so whatever the existing pain pathways there were, he worked diligently to reinforce those.
Yeah, it sounds like it.
Yeah, that was, and what had also happened that during the physical therapy before I had surgery, I injured my shoulder. She had me also do other exercises, body exercises, and I overdid some planks,
strengthening the core.
And so they gave me steroids for that injury. So I also had a shoulder that was hurting, and that didn't go away. The shoulder pain didn't go away. Although the shoulder.
Okay. So you had the knees and now you had a shoulder in addition to that.
Yes. So typical really mind-body syndrome that then other things can come to it and that they can become chronic too. So pain didn't go away the same as it did with the knee. Pain didn't go away even after the surgery. And then a couple of weeks after the surgery, I started to develop bad foot pain. And same thing again, the pain didn't go away. It was starting plantar fasciitis. But there the orthopedist then gave me some Celebrex, and I developed, after a week, I developed severe stomach pain and nausea from that medication. And especially probably because he also had given me the steroids before. So in a whole, my stomach was terrible. And so I went to a GI specialist and who said, this is most likely gastritis, and prescribed me medicines but the nauseousness didn't go away.
The pain
All
didn't go
day,
away.
yeah, all day I was totally nauseous. Every bite of food made my nauseousness even worse. And then eventually they did an endoscopy and they found mild gastritis. So the gastritis might have gotten less, but the pain didn't go away. And
If I may say, if there ever was any, because mild gastritis is a very typical finding again in endoscopy. There's always a slight irritation somewhere within the stomach lining. So if an endoscopist says, okay, these are the symptoms that why the endoscopy was prescribed, and looks at that and says, well, what can I see? Well, maybe it's that. Right? That's really
not
hindsight.
definitive, right? Something that could be within the normal abnormality.
But a mild gastritis, certainly, even if, let's just granted it was a mild gastritis, it would not explain those severe symptoms.
Yes, yeah.
Right.
And then she also found some fungus, and she said that is due to the steroids that I had. Some people get a fungus, and I got then rounds of antibiotics because the pain didn't go away, the symptoms didn't go away. So we were thinking maybe the fungus isn't gone. So it was just so frustrating. And during that whole time, I lost a lot of weight because I couldn't eat. I mean, we made smoothies for me because she said bland food, so it was usually rice, tofu, and some well-cooked vegetables, and put this in a food blender, yeah. But even that, I mean, every couple of bites, I got so nauseous that I felt I can't keep the food, and the whole day
at this point, nobody, I mean, you had the one diagnosis of sensitization from the neurological doctor, but ever since that point, nobody else was connecting these dots that you're highly sensitized, right? And so you can start having all these things.
Yes, exactly.
And the sensitization was just spreading.
Spreading, yeah, that's right.
As the nauseousness says, within the body as well.
Yeah, that's right.
So then I became severely underweight on top. I'm 5'7" tall, and at some point I weighed 100 pounds. I looked terrible. I looked like a skeleton. It was horrible. And of course that was a big worry too, because I tried to force myself to eat, but it was just so difficult. And everybody said we don't understand, and I was sent to either other specialists. I don't even remember physician that to figure out other possibilities why this could. It was really a nightmare, and I was feeling that my body is just falling apart. I mean, it was my knees, I was dependent on the wheelchair, my shoulders just didn't get better, my foot didn't get better, then my stomach, I couldn't eat, I was nauseous really 24/7. And then on top, I developed really terrible insomnia. My whole nervous system, and now I know from, my body knowledge that we have now, of course, I know why this all happened, and I know that insomnia then is very typical. And that my nervous system was just
in constant flight mode.
Yes, in constant flight, absolutely. And so I couldn't sleep anymore. And then when you can't sleep, all the pain, everything feels worse. And I just was at some point so exhausted. Not only at some point, the whole time, I was just so exhausted. And at some point, I just lost hope, and I felt I don't know, I don't know how to get out of this anymore. This is just too many things. And instead of any of these things getting better, it all is not resolving. On the contrary, it's rather getting worse. And so I also developed a lot of anxiety of just not being able to sleep. And then you wake up in the night, and if you get this fear of not falling asleep, your adrenaline keeps going. So
vicious circle that you were falling into.
Exactly. And then that was really hard. And then what really complicated the matters was that after the surgery with the
The second
knee,
one.
the
Yeah.
second one, I ended up in the ICU with sepsis from a post-surgery infection. So I had a stitch infection, and a stitch infection typically is really nothing serious. You probably had this all the time when you were still practicing in a clinic. That just happens. And you give people antibiotics, and usually then they are fine. And I was given antibiotics, we caught it right away. I was not fine. My knee started swelling up like a balloon. It turned blue. And it got then suddenly stiff, and then we knew we need to go to the emergency room. This is, and then
You got the wrong antibiotic.
probably,
Those were different bacteria that caused the infection that just didn't respond to the antibiotic, which that's why.
yeah, that's probably, yeah.
Otherwise, it would have been resolved, but yeah.
Yeah.
But that was relatively rapidly after the first antibiotic failed. It was just within a matter of days, it got so bad that it developed into sepsis.
And then I was in the intensive care unit, and I just knew from stories that when people have sepsis, they often die. And I was there and thinking, wow, you might be dead in two days. And my anxiety, of course, spiraled even more.
No one said that to you, though.
No, but
it's the internal anxiety already there.
Yeah.
Painting the worst case scenario all the time, constantly.
And then the orthopedist came by then the next morning, and he said, well, now we need an MRI, because if that infection spread into your knee, then your knee is done. And then
That's unbelievable.
And then, but if it's not inside the knee yet, then we can save the knee. And I was just thinking, if the knee is done and I need a knee replacement or something, I cannot do this. I cannot have another surgery right now. I'm so weak. We didn't even tell yet about the elbows.
We're getting there.
Oh my gosh.
It was after that anyway.
Yeah. It's sometimes hard to remember everything chronologically. And
How many hours do you have for this?
Yeah, well, we do have some time limit here. I know we could go on for probably hours. Yeah.
I'll try to rush it up a little bit. So I also developed what's it called? A tennis elbow on both elbows, because I was it's like a cast in after the surgery. It's out of fabric, but I wasn't allowed to bend the knee. And so when you lift yourself up or go down from a seating position, you have much more weight on your arms. And I had an ice machine that I needed to do, and there was thick Velcro on it, constantly needed to open and close that. And so, and me having been super sensitized at that point, I developed
tennis elbow.
Tennis elbow.
Both sides.
On both sides, yeah.
Yeah.
And the pain got so bad that I couldn't lift a glass, and I couldn't put a fork to my mouth. It was that bad. I needed to be fed.
So at that point, after you developed that later, the sepsis in the knee was eventually taken care of with the right antibiotics, or what happened with that?
Oh, yeah. That was just a few days in the ICU, and then later, but it was just a few days in the hospital, and then that was gone.
Okay. So that didn't take too long.
But during the time in the hospital, my anxiety, I got basically panic attacks. My anxiety got so bad that I developed an anxiety disorder. It was just, I just couldn't deal with everything anymore. It was, my anxiousness was just, I was like, I don't know how to get back to anything.
I think that is important to point out. It was no longer what we would consider regular anxiety, even with a pain syndrome. This was a full-blown anxiety disorder at that point, which was triggered by this, but it was now sort of its self-sustaining disorder. Anxiety.
Yeah, that's what happens, right? You already had existing anxiety, and that sounds like it puts you over the edge and to a full-blown
It,
anxiety disorder.
yeah, and it's important to understand, right? This is similar to what some people with depression experience as well. Then everyone will tell them, well, I'm sometimes depressed, but I pull myself out of it, right? That there is that normal range of human emotion where you have depressed feelings when you lose someone or you get heart gets broken, so which is entirely normal. And then there is depression as a disorder, same as with anxiety as a disorder. It's self-sustaining, and there is no correlate to anything that's outside, or that it can be attributed to, right? I mean, you
Yeah.
can always in hindsight say, well, yeah, but I have that disorder because, I don't know, I was treated badly as a child or any type of these things. But these are disorders that tend to respond in all regularity quite well to medication. And that may lay the groundwork to address other issues then.
Yeah.
But with that anxiety disorder, it was for you impossible to do anything because it was consuming you at that point. It was absolutely consuming you.
So then we felt, okay, the next step is really we need to do something for that anxiety. So we decided that I go to a day clinic, a mental behavioral day clinic, and
To treat the anxiety.
But the clinic then said, well, you have a what's it called, eating disorder, because you're weighing so little, and this must be the eating disorder. And
Right. She was truly anorectic at that point.
I mean, I didn't have an eating disorder, but I
Just met the criteria.
I just looked.
It's bureaucracy at this point, right?
Yeah.
It's just a couple of criteria, and she met those.
Right.
Yeah.
Sure.
And then we called them, and Juergen is trained in psychiatry, so he's a physician and psychiatrist. So he said she does not have an eating disorder, but they were, no, we need to take her in and then we said, what the heck, then I go in as an eating disorder patient.
This is a perfect example of the carpenter syndrome. I don't know if you heard about that. To a carpenter, everything looks like a nail. Now, that particular day clinic, they were very good at treating eating disorders. So they see that quite often and they diagnose it very readily. And then that's also what they can do. Similar, her previous experience with orthopedists, right? They see a little bit of a shadow on an X-ray or in an MRI. Oh yeah, you have chondromalacia, and that's why that needs to be treated. It's well-meaning, everybody wants to help, but it's not helping. It's actually doing the opposite. And that's that carpenter syndrome, as I like to call it. Delayed effective treatment for you for decades, actually.
Yeah.
Mm-hmm. Yeah. It's very, I mean, it's terrible. I mean, it happens a lot. I mean, that carpenter syndrome is a good way to put it. It's very prevalent, unfortunately.
And then I was in the day clinic, and I was very hopeful about the day clinic. And for a while, things really got better. And then they realized that I don't have an eating disorder. And then they had me join the anxiety cohort instead of the eating disorder cohort. And things got really, I felt emotionally better, but what I needed most was sleep. I felt if I can't sleep, I won't be able to recover, because our body needs sleep to recover. But the sleep did not get better at all. And
I think that the anxiety disorder, which wasn't treated really very well, but it's focused on that, right? It's such an irrational anxiety of not sleeping well at night.
Mm-hmm.
And I think that is typically this irrational anxiety, which is more indicative of an actual anxiety disorder.
Yeah. Well, it can be, right. It can turn into that full blown. So you were getting medication at the time, and getting the inpatient treatment.
And also sleep medication, but the sleep medication at that point didn't help.
Did not help.
Okay.
And then at some point when I hit rock bottom at that point, really, because I had put so much hope in going to that clinic, and but nothing. Yes, I felt a little bit better about the anxiety, but the sleeping wasn't resolved. I didn't see
And the
a
anxiety
way out.
was
The
there. The
anxiety was,
disorder was
yeah,
there. I
yeah,
mean, no doubt,
yeah,
right? I
yeah,
mean, it may have been channeled a little bit better, but
yeah, yeah.
to me,
Okay, so you
as
came out of that experience, you were a little bit better, but not like you said
No,
on
no,
where
and
you
that
want
kind
to
of
be.
that's because of that. I had put so much hope in going to that clinic, and then I got so disappointed. I was that I felt, okay, I've done so many things to get better. I don't think I can get better. I gave up
my,
hope.
my experience was slightly different. I don't think you were any better at all while you were there. What might have helped is that you went there every day. You were busy the day by getting there, not staying at home and having, the anxiety circle going on there, but it was a little bit disrupted. But as soon as you were home and during the night, it was just worse. And as you said, that what you felt that there's really no hope for me, right? I mean, even
Okay, so that was sort of you hitting, even though you had that experience, you were still declining then. You're
oh
feeling
yeah,
worse.
by every means, it was getting worse. I mean, we're getting closer to rock bottom now, Jim.
Yeah. Okay. Yeah, it's a journey, right? Because it's decades. So, well, take us to that, and then we'll kind of move forward a little bit quicker, so we can, and just in the sake of time.
Okay, and then and you were asking before the allodynia, the touch was also then at the elbows. That any touch on the elbows also was really.
And you had to be fed. You were in the
Yes,
wheelchair,
yes,
and you couldn't do
yeah.
much. I mean, it
And
was.
then we got the recommendation for a 21-day clinic program for pain. And that's what I did then. So you go there during the day, and it's a pain clinic. And there I was again somewhat a little hopeful, and the program was nice, but it wasn't really mind-body oriented. They had a psychologist, and the physical therapist that I had, he himself had chronic pain at some point. I think he taught me some of the mind-body topics without really naming it. And that was really helpful. But then the psychologist, and that was the turning point, she mentioned the Curable app. She said, I had a client yesterday who mentioned that she's having this Curable app, and there's even a panic button. I haven't checked it out, but maybe this is something for you. And I right away went home and looked at the Curable app and was fascinated. I thought, oh my gosh, this is great. And when the next day I went back, because on the Curable app they write about Dr. Sarno, and I went back to them and to the psychologist and said, have you ever heard about Dr. Sarno? And she said, no, I have no clue who he is. But that started it all. Then me going through the Curable app, and then I also did a boot camp with Curable. And that
The group class, is that the group class they offer,
yes,
or
yes, yes,
yeah?
yes, yes, and that really started it. And then what I also did is I did hypnotherapy. I hypnotized myself and imagined myself being healthy again. So that's what
Visualization. I mean, it's just
yeah, doing things that I can't do, and that really helped. And so I visualized myself walking and standing and without pain. And let me see what came next. And
if I may add to the physical therapist that you met in that day clinic, which really led to the what was the turning point? He did gradual exposure. He did
yeah,
by the book gradual
yeah,
exposure, and that was an improvement within 3 weeks. I
yeah,
mean, there was
yeah,
no wheelchair anymore. There were no crutches. Were still bandages, but the improvement was, that's when I came around also and said, well, this is it. I mean, this is exactly, you have to unlearn your pain. That's really what he did, even though he never
Yeah.
called it that way, but he did
Right.
exactly.
Yeah. Yeah.
So
Your system was so highly sensitized that you needed to go very slowly to titrate that back. Yeah.
Yes.
that
Yes.
was, at that point, after that long journey, it was like a miracle.
Yeah. And then learning all the things about mind-body syndrome and how it works, and having that pain education was
Yeah,
so
that's
important.
another huge piece. Yeah.
It was such a huge piece. Now I could understand. Now I understood why this happened. That it was such a big piece in that whole journey, and I got hope again. What was really important. And eventually we had an e-bike, because I never could really bike on a regular bike with the family. So we even started going on little trips with the e-bike. And after this, that I started learning about mind-body syndrome, after 4 weeks, my knee that had always still, after a year, it was a year already after the surgery, it still was swollen. I still needed the ice
Red
machine
and
all the
hot.
time. Yes, I brought this ice machine everywhere I went. So also to this clinic. I mean, the other patients were probably super annoyed because that ice machine is so loud. You need to plug it in. It is so loud.
They weren't the only ones.
Yeah. I mean, it was running constantly. With breaks, of course, but still.
Well, you ran it all a lot.
And I was dependent on that ice machine. And within 4 weeks of learning those concepts, my knee stopped swelling. It was suddenly not swelling
Yeah. So
anymore.
you had maybe share with the audience because like you're sharing your story in this, decades of just constant pain and getting worse, and then all of a sudden you learn about this, and it sounds like it sort of just changed, pretty, quickly compared to how long you've had it. So what was
Yeah.
it going on in your mind at that time when you were learning the concept? What was the switch for you? Was there like an aha moment? Was there like a deeper understanding or confidence you had now, or what happened?
Yes. Deeper understanding, learning those concepts. And I was then reading books. I was then doing the book from Dr. Schubiner reading, and whatever I could.
You read Sano.
Yeah, the Sano, but whatever. And there was also something where you were involved. I remember that. And so I watched a lot of your YouTubes actually, which
The
are really
somatic
good.
tracking that Jim did, that helped
That
quite a
was
bit.
really good.
Yeah, it was
Yeah.
very good, yes.
I joined your group class. And that one was really great about feeling your feelings, and there was also you always had a session first where you talked about concepts, and then we did the practices, and that group class was really fantastic. And so what I could get my hands on. And what also had changed, and that was before I did your group class, but also I did was with Lynn Hell's one-on-one coaching. And that also was very important, because at some point I had plateaued with what I could do, and I felt I needed something else. And then I did one-on-one, had a one-on-one coach, and that was really, really important. Although I loved Curable and the group program was good, but having this really one-on-one approach was.
Yeah, it can be invaluable
Yeah.
to talk through things and work through different issues, right? And as you're moving forward.
Yes.
It's also a bit more individualized, because there are many different approaches to mind body, but not everything works for everyone. So you need to figure out which are more appropriate for a particular personality type and for particular issue type as well. So I think that's what helped there quite a bit.
Yeah.
What did you find, just for the audience, what did you find for you personally was really that the most helpful? What were the principles or things that you took that you feel like made the biggest difference?
Finding an inner dialogue with myself. So basically starting to talk to my brain, and doing somatic tracking was very important. So when we went out hiking or biking, I was constantly somatic tracking my way through, because I had pain. I mean, it was not that I just went and didn't have any pain. And so coaching myself through those moments and telling me that I'm okay and that these are just sensitizations and that this is not really important, knowing that it's important to stay chilled during those moments. And so that was really important, the gradual exposure. I mean, we went really from walking 1 minute to 2 minutes to 3, to...
I think, at least from my view, from what I experienced in the whole thing, the gradual exposure kicked off the improvement. I mean, that's where it started, because that's what this physical therapist did. And interestingly, if I may add, to you, it didn't appear that way. It was me telling you, look at how much better you've gotten. And you didn't, in your psychology at the time, you didn't realize it so much. You needed the additional introspection that you learned, the additional knowledge about the neuropsychotic and psychiatric touch point of chronic pain. That then made you more aware of all the improvements you had. Even though she was already getting better, it just didn't register at that point. So the anxiety and the associated fear with that pain was still prevalent at that moment. And one point I think we haven't mentioned yet is we mentioned anxiety disorder before. That was treated quite effectively. And so that created a basis to be even receptive to all of these.
And that was done, like you said, through medication. Did you have psychotherapy or just mostly through medication management?
Medication.
Yeah.
Okay.
Medication, which then almost by the book within 2 to 3 weeks, provided significant benefit on the fear was still there, but that anxiety disorder is completely baseless, really significant paralysis. You were really paralyzed by that disorder. That went away.
And then all the mind-body syndrome exercises and methods, I mean, they work for the anxiety too, somatic tracking for emotions. I mean, what I learned I could apply for my pain, but I also applied it the same way to the anxiety.
It helps.
So the mind-body work really worked for both.
Yeah, you were doing both. Yeah. I mean, I think that idea of the really slow graded exposure, some people really need that. Like your system needed that. And you were doing that even before like the other stuff. So that was like a thing about creating safety in your system. They go slow. And then you combine it with all the knowledge and understanding. And then your anxiety came down from the medication. So everything was kind of now working in the right direction.
And the support from Juergen and our children, I mean, that was just amazing. You always believed in me. You always were behind me. You always, on the whole way, that was always 100% support. And not only that, but for example, if I was really tired because I couldn't sleep well, or if I felt too nauseous still, or had too much pain, and said, Juergen, I don't want to go outside right now on that walk. I'm too tired. He was like, nope, here are your shoes, and you're going with me now outside, and we're going, every day. It's important. You're going.
I think that's important. That really, maybe Juergen, from your perspective, because that's really important, because he was supportive, right? But if you're too supportive and too much babying, it's actually reinforcing the wrong thing. So maybe share that from your perspective.
No, you hit the nail on the head there, Jim. That's exactly it. They're supportive of being empathetic and trying to resonate with the fear and the pain is just reinforcing the hopelessness of the situation. So the real support that you provide is by being the optimistic, by not losing hope, as Petra just said, how much it helped her, even though I sometimes said, you may experience the pain, but we're going to go outside now anyway, and it's beautiful outside, and we're going to concentrate on the sun and on the spring, on the trees getting their leaves and that type of thing. So just distracting from that experience, that's that. It's work for the partner as well, by the way, but it's also rewarding because it does help. It's amazing how much that helps.
I think it's massively helpful to have that. It's like you're having your own personal coach there. There's also your partner at the same time. You're on the same page. And I think And maybe share a bit, Juergen, since you're talking about being on the opposite side of this, how difficult was it for you, or how was that whole experience for you, witnessing that and being going through that?
Well, I mean, it's Petra's pain journey. We like to say it's our pain journey because it is difficult. There's no talking around it. It is difficult for a partner as well. I mean, but the piece of realizing what your partner needs, what for me, it was like, at least in the beginning, more intuitive, saying that, you can't be the one empathizing and losing hope as well. You have to be the light tower in the storm, right? So we're the beacon that provides the stability, or that gives you orientation in that. And I think that was critical.
Yes, yeah, absolutely. I mean, if you and the kids wouldn't have been so strong about it and so supportive, I don't know what would have happened, really.
Yeah. So just to highlight that too for people listening, that you were getting better, but there's like, it was still hard. There were days you didn't want to go out, or the pain was higher, right? If you were on your own, maybe that you wouldn't have done some of the things, right? If
Yes,
you didn't support you or your children say, let's go. Right?
yes,
So that
yes.
was critically important for people to hear, that the consistency of you continuing to go out,
And it also was that I felt I need to keep on going because I cannot. I need to do this for the family. I need to do this for my husband and for the children. I need to somehow go on.
Yeah. So you also had that motivation. That was a driving force for you to get your life
Yeah,
back.
yeah. And sometimes it was really, really hard. I mean, I was
We didn't give up
hopeless.
on you, so you couldn't give up on us.
Exactly. Yes.
Yeah, that's
Yes.
right. Yeah. You held her accountable.
Yeah.
Yeah. So how long was that process then? When you found, I guess, Mind Body, you found the curable, I think that's when it started, right? And then you started doing the very slow graded exposure PT. From that point on, how long did it take you to, take us forward from then?
Yeah. So it really was then just gradually improving and improving. And then for me, it definitely was not one of those fast book cures where you read about it and then you're done. I always was very envious about hearing about those stories, but it didn't happen for me. And I learned then later that often the longer you have the pain, that can also influences usually how long it takes to recover for many people. But then really with the time, I was able to hike and to bike with a regular bike and not the e-bike anymore. And now we are
on top of the mountain.
On top of the mountain. I mean, we are hiking 6 hours on trails where it says difficult, where there's one, I love the sign dangerous. There's one in our area where we live. And then there comes the saying dangerous, and
nope, it's not dangerous, not to me.
Not to me,
well,
and I'm crawling up
you need to be in excellent physical shape to attempt this trial.
Yeah.
I mean,
and we started mountain biking. So that was always I thought this would never be possible, but I always thought it's so cool, people who mountain bike, it's just something that I never thought would be possible for me. So at some point I said, we should rent a mountain bike and try that out. And we came back and I was black and blue because I fell a lot.
Yeah.
But now we have our own mountain bikes and we are biking on blue trails. I'm not at black yet.
Amazing. So as you were doing this, your symptoms were just sort of receding over time, and like you said, you kept going whether there was pain or not pain. I think at this point, right, you were working the product. I think it's important for people to understand, because people think stop start. I got to stop today. The pain's too bad, but at some point you realize that you need to keep going.
Exactly. I didn't worry much about the pain. I got pretty chill about pain. And then, and what I also did, I was again and again thinking, I was saying I had this in a dialogue, I talked about that before. And then I was telling my brain and saying, you know what is safe and healthy for you is to get as fit as possible, to get your knees as strong as possible, to get your arms as strong as possible. That's what's healthy for you. That's where the safety lies. Subconsciously, I think I had, with all that was going on, my brain was saying, "Oh, any movement is bad for you. It can be dangerous." And as a child, I'm very hyper. It doesn't
That's a
matter.
different story.
That's a different story. Yeah,
Yeah.
diagnosed Ehlers-Danlos. But so I was always told, "Oh, you don't do yoga because you're so hyperflexible."
Well,
And things.
that's important too for people to hear that the Ehlers-Danlos, that you had that diagnosis, and that in and of itself makes you way more cautious and worried, about your body.
When I was young, they didn't diagnose Ehlers-Danlos. It was just, at that time.
It wasn't the fashion at that
It
time.
wasn't the fashion at that time, yeah.
Yeah,
But
that's
I was
right.
told when I was young, I'm hyper flexible. So don't do
Hypermobile, yeah, hyper flexible.
that. So movement for me was kind of subconsciously, I think, dangerous.
Yeah.
So so I turned this around in my mind and said, so in the past you were thinking that it's unsafe, or subconsciously you probably thought that movement is unsafe. Now we're thinking that the exact opposite. Movement is safe. That's how you're going to get strong. That's how you're going to get healthy. That's how the pain is really not relevant. You can, as long as you continue and do the gradual exposure, you can go forward. And I was also telling my brain and saying, there's people out there who have bone on bone knees and they don't feel any pain. Brain, I don't want to know anything about anything that's wrong in my knee. I don't care whether my patella is too small or whether my ligaments are right or not. I do not want to have anything to do with this. Just don't stop telling me anything about this. I want to be strong and healthy and hiking and biking. So that was
amazing. It shows you the power of our brains, right? That we have such power in there to change this physiology. And you had, let's come back to that. You had bilateral knee pain, you had surgeries, you had foot pain, you had elbow pain, you had shoulder pain, you had, right, you had lost all this weight, GI problems, you had insomnia, right? And all these things have faded away.
Yes, yeah. They're gone now. They're gone now. Once in a while, the allodynia in my knees comes a little bit back if I haven't worn tight pants for a long time in the summer, and then I go back, and then I'm like, oh, I know what this is. And then I wear tight pants for a while, and then it goes away again. But that's really, yeah.
That's it.
Really...
But see, even now, the way you're describing and the audience probably feels this, when you were describing the depths of the story, you could feel it, the energy of the despair, the anxiety, the negative, right? You're just so wrapped in it, you can't see yourself out. And then you can see how you are now. The way you were coping with it was so different. You're like, oh, okay. The way you were talking to it, the way you thought about it, you totally reframed movement, right? Everything was shifted. And I think that's so powerful to hear.
Yes, yeah. And
Yeah.
it took from the first time I heard the word mind-body therapy, to where I really could hike for 6 hours on trails that are marked difficult, and I'm even rock climbing actually. That was really this gradual getting better and better and doing more, and that was a time span of 2 years.
2 years. Okay, that's good for people to hear. Yeah. How much did you do? Because I always like people want to know what you were doing. Did you do much emotional work or not too much in terms of I know you did some work on somatic work with emotions, but journaling or not so much of that in your process?
I did some journaling, but definitely not daily. It was more this journaling for a period of time with Dr. Schubiner's book and some of the curable, where I kind of needed to understand things that happened in the past. Why I was
the relationships.
In relationships, and yes. So yeah. And I also did a journaling with Anna Holzman. That was a really nice class, a journaling class. That was really good. And so I did it for a while, but then I felt I didn't need it anymore.
Yeah. But do you feel like for you, because everybody's story is different, I always like to tease out biggest things? It sounds like the desensitization, which was the really graded exposure, right, that Juergen mentioned from the beginning, the knowledge and understanding that you weren't broken, there was nothing really wrong with you, somatic tracking, right, this exposure, his support, right, and your self-talk, the way you communicated to your brain, and right, that were those the biggest things that helped, do you think, or was there anything else?
There's one missing, I think, and that's visualization.
Yes.
Oh,
Petra is
okay.
exceptionally good, turns out, at visualization. She can do that really. She can do that really well. She had her vision book as well, or vision, what do you call it? Board.
Yeah,
Yeah.
yeah.
And it's, yeah, you ticked up everything that you put on your vision board.
That is actually quite amazing. So I learned how to hypnotize myself, and I also became a hypnotherapist then. But at the beginning, I learned how to do this, and all the things that I wanted to reach, I put on a vision board, and I put pictures on there, a virtual vision board. So I put pictures of people walking, somebody who kind of looked like me and walking or hiking and standing. So biking, all the things that I wanted myself to do in the future, I put on there, and then I hypnotized myself and was really visualizing and painting pictures in my head of myself doing that and doing it pain-free. So I even would imagine that I'm in a Cirque du Soleil and, kind of floating, doing
She
crazy
hasn't done
stuff
that
there.
yet, so that's still outstanding.
Hey, never say never. Never say never.
But I was just imagining my body being pain-free and being able to do amazing stuff.
Yeah, that's powerful, I think, for people to hear. When you were doing that, I know, because it's interesting to hear your inside your brain, because some people can do that really well, and some people struggle. They get, the other thoughts come in, the distorted thoughts, the bad visualization appears. Was that a problem for you, or you're able to clearly see yourself doing that?
I was able to clearly see that. Yeah.
Okay. Yeah, I think that's important.
Yeah, you're really good at that. And
Yeah.
you're right, Jim, it's not for everyone, right? As I said before, that these various therapy elements that you have in the mind-body work, not everything works for everyone, so you have to find the right mix for the individual and for that.
Yeah,
But the visualization for you was a very powerful tool.
Absolutely. And you're absolutely right. You need to find the right recipe for people. Yeah.
The right recipe. Yeah, that's great. And the visualization, last thing, how often did you do it? Just for people listening, was it a daily practice or just?
Yeah, it was a daily practice. Yeah.
Okay, that's helpful.
Every day, a couple of times during the day, you would treat it for 10 minutes and you just interacted with your vision board.
Yeah.
You did that. I mean, you don't do that as frequently anymore.
No.
But at that time,
but
it
at the
was
time
over a period of 2 years.
Yeah.
I think easily you did.
You're retraining your brain, right? Your expectation was changing. And we know expectation is highly related to the placebo, which is our brain changing. So yeah, you were shifting your expectations and outcome, how you wanted to be, who you're going to be.
Yes, and creating those new neural pathways in my brain.
Yeah, that's right. That's great. Well, that's amazing. So you're back to everything. And so you tell us a little bit before we go here. So you created a website. You have tell us what you're doing now. What's going on now?
Well, that experience that we had, very intense, as you now have heard. We've told that story over an hour now, and we could go on.
And we could have went longer. I mean, into some of the
Yeah.
It was long.
But that experience, it was so profound and in the end so rewarding, even though it took so long. That we just want to share this with others. We know how many people are suffering. You have so many individuals that we talk to in our direct family or indirect or with friends. Everybody has a story and everybody is interested in this. We figured, you know what, that if we let everything else go that we do and focus on that, so we basically open a business. We call it painawaycoach.com, and that's our website as well. And tell the story, which our backgrounds as well, how we got to that. Petra has this training now in rapid transformational therapy. She is a hypnotherapist, and she has done all these trainings in mind body now. which is quite a. I did also training in mind-body medicine. I'm a psychiatrist and a behavioral therapist in background as well. So together we figured, we have a good mix to offer to patients or to sufferers from chronic pain, to coach them through the process and to help them improve.
Yeah, it's
And that's what.
wonderful. You guys are a great team, and right, it sounds like you complement each other with right with each side of the story here, with the medical side and also the what you went through and the training. So that's wonderful. We're going to list that on the show notes too, the link to the website so people can access it if they're interested in learning more. Um, and like it's awesome what you're doing, because we need more people doing this. And usually the people that are doing this are the ones who've been through their own experience
Yeah,
primarily, you know.
yeah,
Yes.
yeah,
So it's powerful. It's a powerful story, and it shows that you can get out of anything. And you had this for decades, right? For such a long time. And here you are now, free of this. You're years older, but you're better, right? You're actually better than ever. So
yeah, yeah, yeah. I'm at a point where I never thought that I could get there. When I had that second surgery, I had hoped to get back to where I was before, wearing the braces, being limited in what I could do. That's what I wanted. But that I could get here where I'm now, that was just not
unfathomable. Yeah, unbelievable. All right.
thinkable.
Yeah.
Maybe.
Well, it's such a get out of jail, you're just free now. And it's probably
Yeah,
feels so, I can't imagine how good it feels.
yes.
We could talk probably for hours, but the story is amazing. It really is. And I'm really happy both of you are out there now helping people. So we're going to put that on there too. If people are interested in reaching out to you guys, they can do that. And I really thank both of you for being here today and sharing.
Thanks for having us, Jim.